Hi everyone, thank you for watching. My name is Ivan Blasquez. What I'm going to be demonstrating is a sit and reach test for flexibility. This test is it is the main flexibility screening that's used for personal training when one gets certified. And flexibility is definitely an important component of fitness. However, this is probably the most common and utilized flexibility screening for a lot of reasons. Number one, it's really determining the flexibility in the back of the leg, the hamstring. Now that is, having tight hamstrings can be associated with having potential low back problems, particularly because if the hamstrings are real tight, it's going to affect your pelvic mobility, which can lead to compensations in the low back, and it gets tight and whatnot to try and counter the hamstrings pull on the pelvis. So that's kind of the purpose of this test, is to essentially assess the pliability, the mobility, and the flexibility of the hamstrings, as well as the calf muscles. Tight calves can certainly play a role in this test. Now the way we do this is, what I like to do is, and the way this is actually taught is, you want to have your client take their shoes off. And then what you want to have them do is make sure their heels are pressed against the back of the box. And this is these instructions are based off of ACSM, American College of Sports Medicine. Their instructions for doing this test. I like to have them have their fingers overlapping, and also make sure to tell them that their fingers one hand doesn't push further than the other. They have to stay over each other. If they do push further, it doesn't count. You have them do it again until they get it right. They get 3 attempts at this, and you record the best score. You have this silver little indicator, and there's 2 sides on the box. There's I like to use the inches side, but then there's also the other side, which is in metric. I believe it's centimeters. So anyhow, so what I do here is you make sure their knees are straight. So if their knees come up like that, that doesn't count. They have to stay straight, okay? Which means a lot of people won't be able to go as far, and that's actually perfectly fine. So you take their fingers like this, they take a deep breath in, and you want to go nice and slow and smooth. And then you keep going, you contract the quads and make sure they're straight, and head goes down through as far as you can go. And you go as far as it can go, and once it stops moving, that's it. Or once the rate of movement changes to where that, you'll be able to know that's it, that's as far as they go. I got 20 3/4 inches, and that's my first try. Sure, if I do this again, I'll get 21 or so, which for men in my age group, because we actually have a norms chart here that has norms for various scores. So very important to do this test, and you record the best of 3 tries. Now another new purpose of this test actually is a recent study that came out that showed that people who have a poor sit and reach score actually had a greater arterial stiffness, so their arteries were stiffer. So it's not a cause-effect relationship, but it certainly is. Informative and important. So it's not just low back tightness and potential problems with tight hamstrings. It's also that if your muscles are tight, particularly the hamstrings, it could also be an indicator of the state of your arteries and them being tight as well. So that should definitely sell this test as far as being a very important test, very simple test. If there's no access to a box like this, you could simply have them put their feet up against a wall, like this. Or, if you have them against a wall, if they can't touch the wall, then obviously that's poor flexibility. But if they can touch the wall, that's good. Then the next would be if they can get their palms on the wall. That's really good, okay? If they don't have if you don't want to do it against the wall, just see if they can touch their toes. If a person can touch their toes, that's a good sign of having adequate hamstring flexibility. There's a lot of people, you'll be amazed, who can't even touch their toes. They can only come up to the knees or their shins. The goal would be to eventually get them to touch their toes. Now there is one obvious caveat with that. There's obviously the limb length discrepancy or differences. Some people have longer legs and a shorter torso, which would somewhat bias those results. However, that being said, they can still, I would say, all in all, they should still be able to touch their toes, at the very least. Now, their score in this box may be different because this box doesn't control for those differences. In fact, there is a sit and reach test that does have a modified or a modifier that actually accounts for that. I have not used it. I've never really come across it, but I'd say for the intensive purposes of this test, going with this box is sufficient, and obviously every person's improvement is going to be progress. So that's the most important thing, is to see improvement and the ability to be able to touch your toes. So hopefully this video was helpful to you, and thank you for watching. So as can be seen here are the norms for trunk flexibility. So I'm in this age range for men, and I was 20.75. So I'm right there. I'm excellent. That was my first try. I didn't even do a second and third, but that makes me feel very good because it definitely is where I want to be, and I want to maintain it that way. So this is in inches. This is average would be 15 to 16 for men. We also have for women, which is higher. Women tend to be more flexible. And these are the norms, and there is the corresponding age cohorts. And this was adapted from the WISE to Physical Fitness, standard sit and reach scores, standard sit and reach test. Thank you for watching.